If you have an ileostomy, one of the most common reasons to return to the hospital is for dehydration. This brief video is intended to help new ileostomy patients better understand the basics of dehydration. We will begin by defining dehydration, as well as how to recognize this problem. Other topics will include monitoring your input and output, improving hydration and absorption, soluble fiber supplements, and finally, when to call your doctor. Dehydration occurs when the body loses more fluid than it is taking in. Before you go home after surgery, it is important that you learn the signs of dehydration and how you can help prevent it. Here's how dehydration happens. Water you take in by mouth is absorbed in the colon, making stool harder and more formed by the time it reaches the rectum. Because your ileostomy directs stool away from the colon, drainage from your ostomy will appear to be more like liquid. This loss of water puts you at risk for dehydration. It is important that you know the signs of dehydration, which include lightheadedness, dizziness, decreased urination, dark-colored urine, muscle cramps, or a heart rate above 100 beats per minute. Dehydration can be prevented by closely monitoring how much fluid you take in by mouth and how much fluid you put out as urine and stool. You will hear healthcare providers refer to this as I's and O's, or intake and output. You will be taught how to measure your intake and output before you leave the hospital, so that you can monitor your fluid balance at home. To do this, you will be given two containers, one to measure your urine and one to measure your stool output from your ostomy. These containers use cc's or mLs to measure the amount. 1 cc is equal to 1 ml, so the two terms can be used interchangeably. You will also be given a sheet of paper to keep track of your fluid balance every day. When you empty your pouch, write the amount emptied in the ostomy output section. Do the same for the amount you urinate throughout the day. It is recommended that you drink twice as much as your body puts out as urine and stool. If your ileostomy makes more than 1,500 mLs per day, there are food and fluid choices you can make to help reduce the output and improve your absorption of nutrients. What can you do to improve your hydration and absorption? Aim for at least 8 to 10 cups of non-caffeinated fluids per day. Good choices for fluids include water, diluted juice, equal parts juice and water, milk, soy or almond milk, or Carnation instant breakfast with no sugar added. Sports or electrolyte drinks are also a good source for fluid replacement. Avoid high sugar drinks, alcohol, carbonated and caffeine-containing beverages. Avoid sugar alcohols found in sugar-free items such as items containing sorbitol, mannitol, and xylitol. All of these items may cause more water loss. If output is high or watery, you will need to replace both fluids and electrolytes. This can be done by sipping on drinks such as Pedialyte, Certalyte, or Gatorade G2, with 1/8 of a teaspoon of salt added per 8-ounce serving. Water alone is not absorbed as well and does not contain electrolytes. Try not to drink fluids too quickly, as these may worsen stool output. Eating foods that contain soluble fiber can also help thicken ostomy output and improve nutrient absorption. Soluble fiber absorbs water and forms a soft gel-like substance in the intestines. This slows the movement of food from the stomach to the ileostomy, helping to thicken the stool and decrease fluid and electrolyte loss. Foods high in soluble fiber include oatmeal, applesauce, ripe bananas, peeled potatoes, smooth nut butters, white pasta, bread, or rice. Here are a few final tips that can help reduce fluid loss and increase nutrient absorption. Be sure to chew food thoroughly and eat slowly. Well-chewed food can improve absorption and digestion. Begin with eating smaller, more frequent meals. Eat 5 to 6 smaller meals rather than 3 large ones. Try eating on a regular schedule. Missing meals can lead to an increase in watery stools and increased gas. Do not try to reduce ileostomy output by skipping meals. Your ileostomy will keep working whether you eat or not. Limit the amount of fluid you drink during your meals to 2 cups, or 480 milliliters. Soluble fiber supplements. If changes in your diet do not thicken the output from your stoma, you may need a soluble fiber supplement to help slow down the passage of stool. Soluble fiber supplements include Benefiber, guar gum, or Nutrisource. These can be purchased at most drugstores and food markets. Fiber should be introduced slowly, starting with 1 serving per day, and increasing over several days to 2 to 3 servings per day. If output still remains high despite trying soluble fiber supplements, an anti-diarrheal medication called Imodium may be recommended by your physician. If this medication and dietary changes do not thicken the output from your stoma, call your surgeon's office to notify them. When to call your doctor. There are additional reasons to call your doctor right away. If you have symptoms of dehydration, such as dizziness, lightheadedness, nausea, dark yellow urine, or a heart rate more than 100 beats per minute, call your outpatient clinic number provided on your discharge instructions. Dehydration is a serious risk. Having the knowledge to prevent it is your greatest tool to avoid it.